One of the things that can help us get a little glimpse of what is there and what isn't is comparing one tendon with another. Generally, that tendon that is slightly angrier, a little more bothersome, may, not always, but may be a bit thicker than the other. It's important to note that everything we're about to do now, as I've mentioned in other videos, in the contraindications, if it's red, hot, and very painful, it's not the right time to do what we're about to see. It's the time to see a physiotherapist for an examination. But if it's red, not because I just scraped it with a shoe, but red as in inflamed and warm, we should refrain from massaging it because it might worsen the condition. So, we compare one with the other, and we're going to start with that technique that we've seen in several videos already on how to release all that superficial tissue we have. Keep in mind that the tendon is a continuation of my calf muscles and the solid muscle underneath. So, anything that happens to my calf muscles will affect my tendon. It's important to release, to free up that entire area superficially at first. Later, we can do a little massage, but for now, let's release all that tissue that's a bit stuck there. We're going to loosen it up. We're going to keep loosening it. It's normal for you to notice in some cases that it's more stuck or that there's a sensation of some bubbles or something like that. That's completely normal, don't worry. So, well, we move it a bit, unless it's very, very uncomfortable. If not, we keep loosening it up. Once we've released all the tissue, we're going to move towards the Achilles tendon. And what are we going to do? Well, you may have noticed that I've placed a roller. If you have a roller, it's good to place it so that the feet can relax, as they often tense up quickly, so that they fall relaxed, not pressed against the table. If you see that you don't have a roller, it's okay. What we do is take the feet off the table. We would move the whole body a bit backwards so that the feet are outside. But if we have a roller or a cushion or something similar, we use it. We go to the tendon, which is all this here, and we're going to give it a little movement. We're going to make a small zigzag with the tendon. This may be a bit uncomfortable, but if it's not, as mentioned before, if it's not red, if it's not inflamed, it shouldn't be very painful. So, we cover the entire tendon and we're going to loosen up that tendon that may be stiff, that may have difficulty moving, or that we notice a specific area of stiffness. So, very gently, we're going to give movement to that tendon, we're going to loosen it up, we're going to move up and down with our fingers. Be careful, as I often say, be careful with your nails. Nails should always be short so as not to scratch the person. We release that whole tendon, relax it, give it movement. We can increase the movement, make it more fluid. When we have everything relaxed, the ankle relaxed, when we have everything, we move on to a specific maneuver for the tendon. But in this case, we're going to focus on the insertion areas. If you notice, the tendon is thinner around here and then it becomes a bit thicker. So, we're going to work on these 2 points. How are we going to do it? We position ourselves at the feet. We place our little fingers on those sides I mentioned, on the swollen part of the tendon where it becomes wider, and our thumbs are placed on the tendon. We are creating a triangle with our fingers, and now what we're going to do is move our fingers up and down, up and down. I'm going to stay at this point and mobilize for a minute, 2 minutes in this position. So, I'm not bending my fingers to make the movement, but the movement comes from my shoulders, practically. So, from here, I'm going to perform that transverse friction movement on the tendon. I make the movement and progressively increase the attention a little bit. We're not going to apply too much pressure because we want the person receiving the massage to feel a sensation of discomfort, maybe around a 6 or 7 at most. So, it should be slightly uncomfortable but not too much. How long? Between 1 and 2 minutes. This technique needs practice, training, and strength because, in the end, it's a repetitive movement for us, and our fingers get tired of maintaining the posture and so on. So, we need to practice. Let's continue. Let's do another 30 seconds. Keep going, keep going, keep going. Alright, we have 20 seconds left. Maintain the position. 10 more. 7, 6, 5, 4, 3, 2, 1, and release. Once we've released, let's mobilize the ankle and the tendon a little bit, loosen it up. There we go. And now, we're going to do a massage of the entire area of the calf muscles. This is a massage where we will use cream. It's a global massage to relax the entire area. If you want to go further, if you want to delve deeper, it's a good time to watch the video I've also recorded on calf muscle release massage, which will be more comprehensive and add more value to the treatment. Otherwise, if we want to do a global treatment for the Achilles tendon in a shorter time, this massage will be more than sufficient. So, what we're going to do is apply the cream and distribute it evenly throughout the calf muscles and the soleus muscle. We will start by loosening the muscles a bit, but in this case, we will mainly focus on the lower area, the muscles closer to the Achilles tendon. We will gradually loosen them up. We are now kneading the lower area, more of the soleus muscle, and we will gradually move upward to cover the entire muscle group. If you have smaller hands or if the patient, your partner, is much larger than you can use 2 hands instead of 1. If you find that 1 hand is not enough to cover the entire leg, you can use both hands. In my case, I am comfortable working with 1 hand, so I will stick with that. Now let's perform a knuckle kneading technique. Again, starting from the bottom and working up to the knee, kneading and relaxing the muscles. Let's do it one more time. Now we're going to move to one side and work more specifically on this lower area, and we can include a little bit of massage on the tendon. Be gentle, especially if there is considerable pain. If there is some tension, we can decrease the pressure to adapt. And when we are in a slightly more distant area, we increase the attention. We descend again, and as we approach the tendon, we release a bit of tension. And again, we ascend and increase the tension. We'll finish with some deeper strokes using the forearm on the calf muscle. Let's do 3 strokes. 1, 2, and 3. We're going to start winding down. So, we're going to release the tension, go slower, more superficial. And gradually release the tension. We gently release the tendon again, very softly, and we're going to perform a stretch. I take their foot, bring it into flexion, and at the same time, I pass my hand over the calf muscle, gently. 1, 2, and 3. And with this, we conclude our approach for that Achilles tendon that may be a little irritated, a little uncomfortable. But be careful to always check for significant inflammation. It's not the right time to perform these techniques if there is strong inflammation. In that case, we would pause a bit. So, I remind you, if you want to extend and enhance the treatment, you can do a calf muscle release massage, which is available on our channel, or engage in specific exercises for that tendon, as recommended by my colleagues. That's all for now. If you haven't subscribed yet, I recommend subscribing so you don't miss anything. See you next time.